Good morning, doctor.
Good morning,
I
ma'am.
invite you for this interview.
It's my great pleasure to be with you
Thank you.
because I always learn something new from you every time.
No, not that great. Dr. Dinesh Govardhan Bhutada. He has completed MBBS, Diploma in Dermatology, LLB, and Fellowship in Cosmetology. He has 23 years experience. He is one of the very popular doctors of Parbhani city. Dr. Dinesh, his name itself talks about his personality. D is dynamic. Always I see him very dynamic and dashing doctor, father. I stands for innovative ideas and he always takes initiative for any good activities in the Parbhani city. N is he's a navigator. He empathetic because he's a cosmetologist, he's a dermatologist. For a common man, the skin problems may look normal, but the one who is undergoing those problems are very sensitive about their appearance. He's very empathetic. He has tremendous empathy for his patients because skin issues affect the appearance of the patients. He perceives their fear and their concern and guides them so well. He's very apt. That personality trait is very good for a doctor, especially the one who is dealing with skin issues. He's also a very energetic doctor. S stands for is very sincere and very sophisticated. He's a male doctor, but he has a lot of patients, females. So, how to deal with female patients? He is very sophisticated in dealing with their sensitive issues. H stands for very hardworking doctor. We'll be hearing about him, about his achievement, and how did he come up to this level, and his social service, etc. He's a very honest doctor, husband, and father. He's blessed with two sons. Doctor, can you brief us about your childhood?
Basically, I born in Parbhani only, in
Okay.
Chaudhary Hospital,
Uh-huh.
29th August 1972, I think at the same time.
Uh-huh.
And I have done my nursery education from Parbhani, modern English school. Then my father's was the government transferable job. So then we went to Akola. From 1st to 5th, I was in Akola. After that, he transferred to Nanded. Then from 5th to 10th, I was in Nanded. Then 11th, I was in Aurangabad, Devgiri College. 12th, I came back to Parbhani in Shivaji College. And after 12th, I got admission in Government Medical College, Nagpur. And after that, I got dermatology admission in Sain Hospital, Bombay. And after practice, I have done the LLB also.
Why did you do LLB?
Because I always look 10, 15, 20 years ahead. I thought that there is a need of medical legal in India.
Yeah, that's what. Yeah.
Right now, also we are not much aware about that, but I am prepared for this medical legal
Yes,
in India.
yes.
And after 12, 10 years, definitely the issues of medical legal will come in India. And my main aim in doing law to just protect the doctor and patients both.
Yes, both. Yeah,
What happened? If you have any skillful doctors,
yes.
he gave his 100% services to the patient, but for some or how reason he get humiliated because of anything.
Yes.
And his and once he get humiliated, then he start taking risk and he start giving his best in his field.
Yes.
And at the same time, patients' rights to be protected. So I want to become the mediator for this patient and doctors. So patient should be get best treatment and doctors should give their best treatment to the patients.
Yes. Then you said cosmetology also you have done.
Basically, I just wanted to go for the pediatric,
Mm-hmm.
but it was very difficult and tough at that time to get the admission in the pediatric. Then my second option was dermatology. It was a very new branch in those days and very neglected branch. Nobody want to go for that. But I always think that I want to do something new in this field. And once I get admission in dermatology, then I start dreaming of dermatology. How can I expand that? And there was no other way to come with cosmetology, trichology. So I just entered the cosmetology.
Your wife is a pediatrician. Now just I get to know that your interest was pediatrics. But God blessed you with a wife who is
So
she's
I'm
specialized in pediatrics.
yes. Once when we engaged and when she got pediatric, then I was happy with the dermatology.
When you started your profession, what type of problems were there? Like you had to do the publicity, or people were aware about skin
Basically, I
issues?
started my practice in 2000, but before that, I was blessed with good teachers in Bombay and in Kolhapur and in Bangalore. And before coming to the practice, I was very clear cut in mind that I have to do something new in this field. So I have not restricted myself to the just OPD dermatology practice.
Okay.
I started cosmetology practice in Parvani in 2000. It was a very new concept in not in Parvani, it was in Marathwada itself. Then I started visiting Aurangabad, Nasik, Nagpur, and with that I start awareing the patients about the cosmetology. What is cosmetology? Before they don't know what is cosmetology. So I used to take the talk shows on cosmetology with a huge mass, and it was a question answer session with them. So they used to ask the questions regarding simple questions: what type of soap to be used, what type of oil to be used, how to understand our skin, and by this I just started growing in cosmetology, and from the day one, I was getting the patients of cosmetology in my practice.
Yeah, especially in India, olden generation, women used to have glorious skin. What was the major reason in olden days when you look at our grandmothers, great grandmothers? They had very good skin, whether it was related to their lifestyle, dietary habits, present generation with using a lot of cosmetics also there,
No,
not that
initial
glorious.
those days, no, the lifestyle was good, a very disciplined lifestyle. The food was good. There was not much. They are not exposed to a big platform, so they were not. They were taking the simple things and they are just following those things.
Yeah.
But nowadays, this is the media of social. This is the age of social media, and now everything new. People are coming with new things, and without knowledging those things, they start applying that, and they land in the problem. So I think nowadays the problem is increased because of lack of knowledge. Though we say people have a lot of knowledge, but I think still there is a lack of knowledge.
Yeah, the awareness is very less, and even the diet of when I'm talking about diet, is it which age group you find? Is it middle age more or teenagers? The skin issues,
No, it's in all age group,
all age
from
groups.
newborn baby to the 80-year-old lady.
Okay.
We see not related to diet, but skin problems are everywhere.
Among your patients, who are the big age group people? Some issues you find.
No, mostly the teenagers are the more patients, but I get every type of patients.
Yes.
And the whole day, my every OPD is followed with some good procedure to them. So I get all type of patients, but teenagers are more.
Can you talk about your favorite teachers who had great influence on your
Actually,
practice, especially when you're dealing
still
with
I am in
patients?
touch with my nursery teacher to PG teachers.
Uh-huh.
Though some are alive, some are not here, but I am very much
Attached
with the
emotionally.
teachers. So one of my teacher is Mungikar madam. She was with me since from 5th to 10th, and she was I was motivated with her.
Was she?
She used to teach us
Mathematics?
physics.
Physics.
Yeah, but other than physics, she used to take cover of everything. And
Beyond the syllabus.
Beyond the syllabus. But I'm very much blessed with all good teachers. Whenever I'm here, I got Ghares sir, Halge sir, Pedgaukar sir. In my school days, Mungikar madam. In my PG teachers, in my dermatology, I got Dr. Dinesh Deshpande sir, Dr. Heda sir, Dr. R.R. Chaugule sir. And for success, you should have a good teachers.
Yes.
Without teachers, you can't get success.
Even my mother used to tell, if you had to get success, you must have good parents, good friends, and good teachers. These
Are almost there, but
Yes.
inside the home, the parents are there, and outside the home, the
Yes.
teachers are there.
Do you think your friends also played a big role during college days?
Basically, I was a favorite among my friends
Okay.
because of my nature, and so my friends used to wherever I go, used to go, I get attached with my friends. So I have a lot of friends wherever my father is transferred, and I have to go to new schools.
Yeah,
You have a lot of friends.
yeah, this might have been definitely all because you have to get adjusted to
Adjust to
the
the new atmosphere.
various social environments.
Yes.
So yeah, that is how your social competence is very
Yeah,
good.
that's why. Otherwise, it was very. It gives phobia to get adjust in the new
Yes.
atmosphere.
Few problems also you get upset when you are losing good friends.
But
when you have
right
to
from my
move.
school education to PG education,
Yeah.
I had a good friends,
Yes.
and there was no easily from first day I got good friends. Basically, once I completed my dermatology, it was a very pure dermatology. It was a pure OPD practice. Hardly there was one or two instrument people used to use in Marathwada, electrical cautery and simple machines. But as my vision was there that I have to do something new, I just taken training under Dr. R. R. Chowgule in Kolhapur. And once he has some limitations, then he sent me to the Bangalore. Bangalore was at that time in India, it was a more than better in settled than Mumbai. So I worked with Dr. Rajan. There I saw first time the lasers and the whatever new machines are there with Chowgule sir and Rajan sir. Then I am the first to start the OPD practice, skin practice with lasers machines. So there are now 30 to 35 procedures we do in our clinic. And now in the age of lasers, peels, cryotherapy, and for every disease there is one therapy, and with that therapy we get that disease treated earlier with medication. So now I am working in cryotherapy. Now this is a very new, nobody in our area and very few people in India, they are working in cryotherapy. So I am doing a lot of work in cryotherapy. Very soon some researches and publications come out that also.
Okay. You do conduct research.
Yeah.
Like what type of research so far you have conducted?
No, I'm
Means
just.
what therapy is given, treatment is given, what is the impact on the patient?
Yeah, there was initially for just for pigmentation. People are more worried of pigmentation. Then there were only medicinal therapy. Just I have started taking use of lasers.
Yeah.
Then I've started using peels, and then I come to know that with this combo therapy, we get the result earlier. And at the same time, with proper counseling, with combo therapies, and patient to patient, the pigmentation is of different etiology. So we have to just understand that, and then we have to go ahead. So whatever the techniques, machineries are available, I'm just combining these machineries, and I'm trying to get the results faster.
So you keep on upgrading and updating your
Always, every day I learn something new in my clinic.
resources for
Basic-
updating your knowledge.
Basically, what I have during my postgraduate, what I learned from my Dr. Heda sir and Dr. R. R. Chowgule sir, that impact is in my mind. And whenever I start the practice, then from practice to practice and with experience, you start adding something new.
Yes.
And every time you go to the conferences, just one thing we learn from the conference, our conference is successful.
Yeah. So always you keep
Conferences,
yourself in a learning mode.
Learning mode, yeah.
Lifelong learner.
When we learn, we can expand our knowledge.
Yes. When we were talking about all these skin issues and all, which part of the body, whether it is a face they're concerned or hair, in general, current issues are?
Current issue, patient is more worried of face and hairs.
Okay.
Many times I am surprised that 50% of it is on my hair only.
Okay.
And patient don't know whether their hair fall is real hair fall or placebo hair fall. So from that we have to start the therapy. Many times just we have to properly consult the patient, and many times many patients require the therapy also. But more patients we are getting of face and hair.
Because these two affect the get-up of a person, appearance. What might be the major cause for this hair fall? Many people say stress. The more you are getting bald, it is a stress.
No,
I do feel that because
one of the major causes of hair fall is the stress. Second is the nutritional deficiency. And third one is the unwanted things to be used
unnecessarily cosmetics.
So
Sometimes wrong cosmetics.
wrong cosmetics, some hair dyes, hair colors, chemical mehndis, and some people use the straightening, and they want to.
This is very good. Yeah. Even I feel the teenagers, even they have to go for a simple pot. Even the boys, they use that electronic
Yeah.
devices, electrical
Because of that,
devices.
what happened? Just like skin, hair is also having three layers.
Yes.
With this application of devices and chemicals, the hairs get damaged,
Yes.
layers get damaged,
Yes.
and for time being, for few time, they looks good,
Yeah.
but for long term,
Yes.
they get
They
affected.
should not be using it. But they try to copy the.
So nowadays, I saw many patients in the marriages. If there are six functions, they
Six
get six
kinds of.
makeups of face and six hairstyles.
Yeah.
So this damages, and mostly I saw that a couple come to me that when we get engaged, she was having nice skin, nice hairs, but after marriage, she got affected in the hairs and because of all these problems.
Yes. Olden days we had, but hairstyles only with with the pins. I remember my
Yeah.
mother also used to have different hairstyles suitable to their age and profile.
Basically, in a less handling of hair
Yeah.
is the longevity of hair. We should handle the hairs.
Hair.
Excessive
Should not
handling,
disturb it.
and excessive handling, excessive using of chemicals, they harm the hair cycle.
Yeah. But this fashion, it has become fashion. They spend a lot of money, not on the books, but on the.
I found those patients who are having white hairs, they want to make the black hairs, and those who are having black hairs, they want to make the white
Yeah,
hairs.
that is, yes, even
So
I
this
see.
type of patient's requirement is there.
Yeah, even.
But I try to I convince them that just keep the hairs natural.
Yes.
If you want the long life of the hairs.
Do they regret the people who have misused their hair, wrongly handled?
Yeah, definitely. I can.
After you educate them, do they regret for that?
Yeah, they regret, and they used to say that nobody was there at that time to tell us, and we land in this problem. Sometimes patients like this, and sometimes the patient said that there is no option. We have to go for that.
Yeah. Is it more peer group influence and the social media too much giving importance to their appearance than to their internal abilities? Do you find when you are talking to the patients that the confidence level, like Mahatma Gandhi ji, he was bald, but he was so confident. He gave confidence to others also. But why small things are disturbing? Why are they going for more external? Do you think it is a peer influence or this social media?
Yeah, this is
Both.
because of all there is a use and misuse of mobile. People are using, and now this mobile is so open.
Yeah.
So people just they go for the 1 minute in the mobile, and where they don't know how
There are
many
many
hours
ads, they get influenced.
they get influenced, and because of now what we are getting, not we are not getting disease patients or patient is having old age disease because of this social media. They are applying something which they don't want,
Okay.
and because of that they are landing in the problem and they are coming to us.
So you mean to say this hair fall and skin diseases are not related to the more aging? Generally, with the aging, we feel like even I have loose skin all
No,
that. But now, what you're saying is social media impact and ads. They are influenced by these ads and they're using the wrong things.
Wrong things.
And those patients are more.
They are getting more problems.
Not age related, as they're
No, aging is the simple process that
Yeah.
goes with everybody.
Yes.
You are good skin, good hair. This is comes with hereditary.
Yes.
But we have to also maintain that. If we won't maintain, we are against those, then they land in the problem.
Can you just quote one or two without telling the names? Very successful, which you also felt it may be impossible the results if we treat, but
We have just a Elman radio frequency machine that is a US based, and that machine has given me a lot of confidence in my practice. That is the bloodless, penless, scarless machines. And with that machine, we can do any fine cosmetic surgeries, and without any with only with topical anesthesia, and that gives instant result. So I have a very good experience with that machine, and with that we have a lot of new therapies. But my main machine is the Elman radio frequency. And I found I have a number of examples. Patient come with a lot of problems, and whenever he left the clinic, he left the problems there only. So it was a magic for them, surprise from them, and they have never thought that they can
look so nice.
So nice.
Get rid of all
Just
these issues.
for example, if a patient having multiple more than hundreds of tags on face, Just like eraser, we just remove this tags with that element radio frequency
So
machine.
beautiful.
So patient is happy. His face is drastically changed, and after seeing his face, he won't believe that my face can be like this. So these are a lot of examples we get this.
You might be getting a lot of satisfaction,
Yeah,
immediate results.
immediately.
As a professors, we have to wait for 1 year. We teach them, then in the after their exams, we get to know what did they learn. For you, how many minutes? Like
I think it's not more than 40 to 45 minutes for each procedure.
means within a 1 hour,
Within a
1 hour before the client,
Client and
the patient, and after.
while counseling the patient, we tell them that you came with a lot of tax.
You take
You
a
will-
picture
you will
and
leave the
see after
clinic
the treatment.
with leaving the tax here, and tax will show them immediately instant results. So that machine gives very fast instant results, and that machine is so pinpoint. It is a radio frequency machine. Whatever the radio waves, they are used in that machines. So it's if a hair-like probe is there, if we touch that only to the skin, only that much skin is affected. It won't affect the normal around its skin. So we are so confident that what we are removing, that is removed. We are not damaging the normal skin. Basically, our branch, cosmetology, it's patient has to counsel very crystal and clear. Until I answer the what procedure I am doing, the patient is not knowing that, we can't go for ahead. Once the patient is clearly counseled, then patient is easily get the procedures. Most of my colleagues, what happened, I saw they have the difficulty. They always tell me, Dinesh, you to have a lot of machines, we to have a lot of machines, but patient won't get treated with machinery treatment from us. They just want OPD consultation from us, but for procedure they prefer you. Why? We said you are lacking in the counseling. You tell them what you are doing, how you are doing. Don't impose them for the. Don't force them for the surgery procedure. Let them fully satisfied with the procedure. If you have another patient for procedure, show them that procedure. Then they start getting confidence that I have to get treated. But
Highly skillful doctor is required for this minute things.
That you get with your
Very-
confidence of patients and your patient confidence. That is very fine machine, but it's extraordinary machine. So the time any lesion just near the eye, ophthalmologist refer to us to get remove that because they are working inside the eye. Just outside the eye, anything is there, na? Then surgeons are not going for that. Ophthalmologists are not going for. They are referring to us to treat that. And just because of that machine, I can treat. If the machine is not there, I can't.
What type of care you have to take when you are dealing with especially sensitive organs, eyes, nose, when you are dealing with the patients?
No,
with the eyes?
after any radiosurgical procedure to the patient, we just ask them not to apply the soaps or any chemical on the face. Just wash the face with the tap water. But it is so fine and it's so superficial. It gets healed within 2-3 days. So once the patient looks his face in the mirror, he gets satisfied, and no post care is required much.
When you are talking about you are so skillful, even I mentioned that you are very empathetic. What kind of child you were in the school and college that transformed you to this very effective doctor? Generally, all of us are what we were also in childhood. What kind of son you were in school age? Dinesh means, yeah, these are the special characteristics of Dinesh in college.
When I was in school and I was in college, I was simple, not much. I was less harmful for anybody in my college and school days.
Okay.
So though there were 2-3 groups, but I am attached to all the groups.
Yes.
But I'm not dominating in my friendship. So I was easily adjustable in any group.
Easygoing and
happy
going.
going like this.
Uh-huh.
So my approach was so that's why all my friends are connected to me. I'm just very cool with my patients, friends.
You said about teachers also. You are very attached even with your teachers, whoever are alive. This itself talks about a basic quality of a student. Generally, good students are attached to the teachers.
Yeah.
And that is why teachers also value. Once you value somebody, respect a teacher.
I have so much bonding with my teachers,
Yeah.
and I have not. The teachers used to sacrifice something for me. just I want to share one example with you. When I was doing post graduation, it was my PG teacher was Dr. Dinesh sir, but he had some issues with high authorities, and he was planning to resign that post. But if he resigns, I'm losing my PG post. So again, I was in halfway. So I told sir, if you resign, what is my future? So he said, okay, I will just continue 1 year till your education is complete. I won't take any money from hospital. But for just you, I'll be here. And as soon as you complete your post, you take my resignation and give to them. So this much teachers are doing for us. So how can we forget the
Very
teachers?
committed teachers.
Yeah.
Where
And
was
literally,
it? This Deshpande sir?
he is from Bombay. He is the Bollywood teacher, Bollywood doctor. He used to treat Amitabh Bachchan and Jaya Bachchan, all these things. But he was untouched with this cosmetology. And what opportunity I got once he got retired, then he was joined some Karimnagar Medical College. And nowadays, in every medical college, until and unless the cosmetology laser setup is there, they used to have their permission issues. So then, after my practice, or after 5-7 years of my practice, he came to Parvani, stayed with me for 7 days. He told me, show me all these procedures, so that when the people will come for inspection, I have to explain them. So this is my relation with teachers.
Yeah. Give and take.
Give and take. So now he is no more, but I'm still attached to their family. I'm attached to my all teachers.
It's a great pride, teacher is coming and updating, new technologies,
It was
new
and that way
procedures
Dr.
from a
Dinesh
student.
Deshpande, who is the
Renowned,
renowned teacher in Bombay.
doctor. But that type of humility they had, modesty. The teachers never felt I should not, learn from my student. That's a great quality of a learner.
Yeah.
So nice.
And one of my teacher, Dr. Ghanshyam Heda sir, he's in Kolhapur, he's still practicing. He has given me the knowledge of dermatology. He had shown me how to see the patients and with a faster way. How to pinpoint for the diagnosis. How to give the minimum medicine and treat the patient well. So just still, if I had any problem, I talk to Dr. Heda sir. So this is the patient, and I am this. And he guide me today also. Just day before yesterday, I had one patient of Nanded who is having toxic drug reaction. I have not seen such type of patient in my
Entire period.
So I just talked to my sir. He told me this is the medicine. Just increase this dose, and definitely she will improve in 3 days, and that happens. So much
Wisdom.
Yeah.
Can you give some 5 tips what is the best way to take care of their hair? Whether hair care will be irrespective of the age, same care, or teenagers have to take different care and
Basically, there is a universal hair care formula for women and universal hair care formula for men.
Okay.
So we used to tell the women, you have to take the hair bath twice a week. You have to apply the coconut oil before bathing, and just proper combing. Don't apply any chemicals. Don't do the handling of hairs much. Don't go for the different hairstyles. And Indian diet is the best diet. If anybody is taking proper Indian diet, it doesn't require any other nutritional supplementation.
Yes.
What I feel and I saw, those who are lacking in the Indian diet, they have to take the nutritional supplementation. So just diet care, less handling, proper hair bathing, proper selection of hair shampoo. That is enough for the hair cycle to grow.
Why did you say women and men have different?
Because women have the long hairs and men have the small hairs. So men can take the daily hair bath. Okay. No issue. But women can't take the daily hair bath.
But daily hair bath does not affect hair.
No, that affect in females because they have the long hairs.
No, for men.
But no, it's but somebody have the habit of daily taking bath from hair. So if we stop that hair bath, they won't feel fresh. So I just continue with the same. Somebody is doing that follow, they have to follow. And some people are doing hair bath in alternate day. Let them follow those. But many women in some communities they daily do the hair work, but that is not as well for long hairs.
But if the women have short hair, they can.
They can, yeah.
What about the face?
For face, first you have to understand the type of your face, whether it is a dry face, oily face,
The skin
normal
has to be
face,
examined.
mixed face. Skin has to be examined.
By the doctor.
By the doctor, you can do that examination at your home also.
Okay, what are can you give the tips for a common man, a common woman?
To know the type of hair,
Yeah,
type of
no,
face.
facial skin.
For just if you want to know what type of facial skin you have, is a simple test. Before going to bed, you just wash your face, go to the bed. In the early morning, you just get up, wake up. You take a blotting paper, soft blotting paper, just apply on your face. If it is a dry, there is no spots, then it's a dry skin.
Okay.
If it is having some tiny spots, then it's a normal skin. If it is having some big oily spots, then it's a oily skin. So this is the way to understand. And after once you know the what type of skin you are having, then accordingly you can select the soap or face wash, and accordingly you can take the care.
What is the best food for having good hair? And it's not like that. General Indian traditional
Indian
food.
diet is a good, but if you add two things in the Indian diet that enhance your skin and hair, flax seeds, what we call javas or alsi. So this is very good for hair and face skin, and another is the coconut. So just I give one example to all my patients. Take a coconut, go to the temple, and the whole coconut you don't give to others. You eat yourself for 1 week.
Yeah.
One coconut in a week, and flax seeds 2 to 3 spoons in a day.
Yes.
That gives you good health for your hair, skin, and that is also good for body also.
Yeah, might be because I had 5, 6 Kerala friends. They eat lot of coconut and they have shiny hair,
hairs,
very soft hair, and spotless skin.
Coconut is having
Lot of advantages.
relation with hair and skin.
That is why I think.
And now people are not using, there are many, out of 10, 9 people are not using coconut oil in our patients.
Yes.
So
It was compulsory.
coconut oil on hair, it acts as a conditioner. It conditions your hair. So once you apply the coconut oil, there is no need to apply any other conditioner to the hair.
Yes. If we see our generation, school age photos, everybody had oiled their hair and had 2 plaits. Now you find students having dry hair,
Dry hair,
or non-oily hair.
No, but that affect the longevity of the hair. If you want a good hair for long term,
Yes.
so you have to use the coconut oil.
The students after MBBS who want to opt for this, what type of abilities they must have to go for dermatology, or does not require?
No. Basically, right now, the dermatology at the top. Everybody, the people scoring in NEET PG, they opt for the dermatology.
Yeah.
So, but now in our days there were very few seats. So very few dermatologists were there. And right now there are a bunch of seats and lots of dermatologists in the town. But you can get the dermatologist seat, but until unless you have that eager to do something new in dermatology, you won't be successful in the practice. Now I found that many new colleagues have come in everywhere, but they are not doing that work which they are supposed to do.
They're happy only with the routine.
They should have some eager to do something new.
Learn more and more.
Otherwise, you get a simple OPD. They are busy in their routine stuck up work. Then patient is frustrated, doctor is frustrated. So you have to give best to the patient. So after MBBS, you have to go for the PG entrance exam. Now for every post graduation, you have to go for the entrance. And in entrance, whatever score you get, accordingly you can get the dermat set. I have done the diploma, but now the diploma is not there. Only all post MD seats are there. In our days, there was MD and diploma both.
What is your take on the women patients are increasing or men are increasing?
No, men patients are increasing. Initially, women's, now the men's are more aware.
Okay.
and means they are using something wrong things and they are coming. Same with the females also. But few patients, whenever the patient get attached with me, I tell them once I treat you, don't anything you want to apply on the face and hair, just consult me and apply. Otherwise, I will make your skin fair, I will make your hair is good, and you apply anything wrong way, and again you will land in the problem. And once I give the proper counseling, the patient is detached with all these unwanted things.
When I was in the university, there was only one or two creams, hair creams for men. No snow, nothing. It was a family. Any snow,
Yeah,
any
yeah, yeah.
cream. It was powder. Everything was. Even the perfumes. I remember till my PG, the perfumes were for male and female, the
Females.
common one. Later, with the advertisements and this new technology, good and bad, now everything is fair man, fair women, all this. That is why they are applying that. That is why the number of patients are increasing.
Yeah, yeah.
That might be the reason, or
Now,
lifestyle also.
no, that is one of the major reason.
Major
There
reason.
is a lifestyle, but that is one of the major reasons.
Major reason.
But
Impact of
nowadays, the people are getting late sleeps. All students are getting late sleeps. That is one of the major
sleeping
reasons
pattern has
that
become.
imbalance your hormonal changes in your body.
Yes, irrespective of age group, sleep
sleep.
is affecting the human health.
In our India, you have to sleep before at least before 11
Yes,
and wake up at least around 6 to 7.
yes.
But now that totally changed. People used to wake up till morning and they go for the
Some go to bed only in the early
in the
morning.
morning. Yeah.
They start sitting for studies also late,
Late, yeah.
and they say.
So that imbalances their normal hormonal cycle.
Yes.
And not only they land in the hormonal skin issues, hair issues, but multiple issues. So now, when a patient comes to me, I just not only treat his disease, I just try to tell from my side the disciplined lifestyle, whether he want to follow, not follow, but
You must.
I tell and live that. Because most of the patients follow.
Anything else you want to advise through this interview to the common public? Already you said a lot of things.
No, I just want to that be a learner throughout your life. Sharing is increasing your knowledge. Don't keep your knowledge. There is one proverb, "Jnana dilane varte."
Yes.
It's very true. Don't keep your knowledge to yourself.
Yes.
Many doctors ask me, why you are giving your secrets of practice to the everybody? And that's not true. If somebody has not given to me, how can I learn?
Yes.
So it's my duty. I'm here for some. This is the Kali Yuga. Everybody has to pass away. But give something new. Whatever you have the knowledge, you just expand the knowledge. So be learner, be sharing in the knowledge, be crystal clear in your things, whatever you do. And once you are honest, you are doing your best, everybody behind you. Don't think that with this you can achieve this and with that you can achieve that.
Yes.
Be honest in your practice. I just want everybody to, and there should be
Eagerness.
eagerness in you for anything, whatever you do.
Yeah.
And whatever you do the best of your knowledge. If you don't know, you just get it done from, you just tell everything.
Take the help of
Other
seniors,
There are a lot of
teachers.
seniors, sir.
Yeah, there are so
I remember that patient, if I had not taken the help of my Dr. Heda sir,
Yes, yeah.
they have gone in the long
Might be,
way.
or it might have taken more time.
More time, or it was a life-threatening
Yes.
drug reaction. So nowadays, I found what I am finding, people getting good doctors is their fortune.
Yes.
Basically, if you are in the hands of a good doctor, matlab that should be your
Yes,
fortune.
yes.
Otherwise, it's now scenario, the things are going, it's very bad.
Very bad.
Now in our days, if you have a lot of money also, but if you have not scored a merit in our class, we won't get the admission in medical. But not in this.
No, everything can be purchased.
Everything can be purchased. So this is very bad in medicine side. In medicine, it should not be
Most of
there.
the fields, even teacher also.
Yeah.
They cannot just bribe and become a
So right
teacher.
now, I have seen many things. One of my friend shared one example with me. He's just plain MBBS. He's a medical officer, senior medical officer in one town. He told under with me there are four anesthetists and two gynecologists. But if I was surprised when he was giving 25 prescription, but he is not able to give the anesthesia to the patient, though he has done the degree in anesthesia.
Yes.
Gynecologist is not able to do the simple procedures in the gynac.
Yes.
So this is with new doctors. They
New
have to-
doctors, yeah. And so many colleges are coming up,
So many
and
colleges
the
are coming up.
labs are not upgraded.
Yeah.
The practical experience also is not given, enough
And
practical
patient
experience.
is not, doctor is not giving time to the clinical history, clinical examination of the
Yeah.
patient. Everything is report oriented.
In most of the degree programs and postgraduate programs, that is only big drawback in education system.
Yeah.
With the increase of colleges, the facilities are not that good, especially for hands-on training.
Yes.
Uh,
Government is trying to make more and more doctors available, but
Yes.
those doctors are not
Well trained.
Well trained.
uh,
So they are playing with the. I think they are playing with the health of the patients.
yes.
And once you admitted in a corporate hospital, you never know who is going to do what.
What?
So still in India, many patients prefer a known doctor,
Yes. And
Other
even
than-
family doctor. One doctor is to be there, take care.
Now again, the concept of family doctor will to be around.
Olden days, there was a family doctor concept also. So the doctor would know the family history, need
Yeah.
not again ask questions. What kind of relationships they had, what type of lifestyle, what type of values the families had. It was very easy for the doctors. Now, super specialization, and the patients also keep changing their doctors. Because sometimes doctors also, you said, the patient is lucky enough if they are blessed with
Good doctors.
good doctors. So that
Now it is true with this scenario. Now again the time has come. Olden days are going to come. Every family have some family doctor.
yeah.
A good family surgeon, a good family physician, at least both. If any physician condition is there, that family physician is going to attend him. If a surgical condition is there, he is at least properly guide them. Otherwise, if you don't have that opportunity, then it's your luck. It's very difficult. Now the new doctors are not that much trained.
Yes.
They are not taking much trouble. No, they just want to do their duties like corporate duties. They are not 24 hours available to the patients,
Yes.
but they have to be.
Yeah.
Doctor's profession is that if you are free, if you are available, you have to attend the patient. If you can't say that I can't attend the patient. They have to attend the patient.
So now, in general, this infrastructure is improving, but the professionals, whoever it is, in any field, their own capacities, their own skills are not that refined as compared to the advances we see
Yeah.
in the infrastructure of hospitals or offices or labs in the institutions.
Yeah, it's true. And now the AI is going to come in our with us.
Yeah.
This is again going to affect a lot in the medical faculty. Artificial intelligence. Actually, already radiologist is not taking having work in
Yes.
foreign countries because all reports are
Printed.
all reports are given by AI. Whatever the AI is giving the reporting,
Yeah.
then in blood samples again they are going. Same will be coming in the India also now.
Yes.
So now AI is there to whatever you ask to the AI, is giving full prescription, full medication.
So
People are
there can be some dangers.
yeah, definitely. And for that, if you have that knowledge also, you have to consult your proper family doctor.
Yes.
Until and unless you won't be
We cannot
proper
just
treatment.
rely
Yeah.
on the reports, medical reports generated by
And
this.
now what happened? Just I had been to Jamkhandi for last week.
Mhm.
One patient shared one example with me. He was having history of headache only, migraine pain. Somebody had advised him to go for the CT scan. In one lab, he went to the CT scan. The problem was they have shown problem infarction in right side. In other lab, they have shown problems in the left side. And in third lab, they said it's absolutely normal.
Which
So,
which one?
what is
Which
going on?
one to believe?
Which one? This is happening. So nowadays, if you have any chronic disease, you just understand the disease. You take different opinions, and then go for the proper treatment. Otherwise, you should have some family doctor who is going to guide you.
Yeah, more reliable.
Otherwise, accidentally you are entering in any hospital, God is going to save you then. This is today's scenario.
Yes, yes. Every patient, every family undergoes this type of.
Yeah, that's why to my all near dears, I tell that you should have one or two family doctors very close to you.
Yes.
Whatever problems regarding medicine comes to you, you just contact them, and from their side, you go to the proper doctor.
Yes.
Otherwise, if you land in anybody's, it's very difficult. You can't predict.
Thank you so much, doctor.
Thank you.
Very interesting and very useful information. I'm sure the audience will love this
Yeah,
episode.
it's a pleasure.
Thank you.
Thank you.